Every system is perfectly designed to get the results it gets.
This idea is at the heart of quality improvement, the applied science of using system change to improve outcomes.
Quality improvement has transformed industries like manufacturing and aviation. But the performance of systems doesn't just determine the quality of goods and services, but the conditions of life, like healthcare and housing.
The Institute for Healthcare Improvement was founded in 1991 to understand whether the concept that was transforming other sectors could be applied to healthcare.
We first connected with IHI because of its 100,000 Lives campaign, an initiative to reduce morbidity and mortality in healthcare. This inspired us to launch a campaign to help 186 communities house 100,000 individuals experiencing chronic homelessness. And they did it. They housed more than 105,000 Americans, yet none of these communities succeeded in ending homelessness.
We saw that housing placements alone could not end homelessness. We'd have to learn what it would take to drive the total number of people experiencing homelessness to zero.
In 2015, we launched Built for Zero, a movement of communities working to measurably and equitably end homelessness. And they've proven it is possible. One critical pillar of that work has been designing systems aimed at making homelessness rare overall and brief.
Having a clear, measurable, shared aim is improvement science canon. We must ask, what are we trying to improve?
That means moving away from defining success in terms of individual programs alone.
Instead, Built for Zero communities work toward a shared aim to reduce and end homelessness itself, population by population. They work towards functional zero, an end state where fewer people are experiencing homelessness in the community than can be routinely housed within a given time.
Improvement is only possible with effective teams made up of people working from within those systems, and leadership that champions the shared aim and focuses on reducing barriers to innovation, testing, and change.
In any community, many programs and agencies respond to homelessness, but typically they're working independently. Built for Zero communities knit together an integrated team that works toward the shared aim of measurably reducing homelessness across the community.
Together, they shift their philosophy from my client to our clients.
Improvement science requires tracking and understanding data as frequently as possible. Simply put, the rate of improvement is directly correlated with the pace of data capture and reflection.
Homelessness is a dynamic problem. It changes day by day. That's why Built for Zero communities work toward quality data, which means knowing everyone experiencing homelessness in the community by name in real time.
This data helps the community deliver solutions to reduce overall homelessness and provide tailored support for each individual. Bakersfield and the surrounding Kern County in California use by name data to understand how to drive reductions in chronic homelessness, reaching and sustaining functional zero over time.
You need clear, specific, well-evidenced ideas for how to improve the performance of a system. But testing these ideas in real life is the key.
The Bakersfield team tested some ideas they expected to be game changers, but weren't. They tested improvements in rapid cycles that led to more efficient systems and steady reductions. Using their data, they could see what actions were driving towards zero.
Knowledge not shared is wasted, and connecting organizations to learn from each other helps them discover faster what it will take to move a whole system forward.
Built for Zero promotes learning within communities, among cohorts, and across our national network by bringing together community teams twice a year to facilitate peer learning.
This focus on knowledge sharing and peer connection has accelerated communities' progress toward functional zero.
In the social sectors, there is a tight, loose, tight relationship. Tight on aims, loose on how teams get there, and tight on measures and outcomes.
Almost every US city has a strategic plan for ending homelessness, but they're often an inverse of the relationship suggested by improvement science. They're loose on aims, tight on technical strategies and investments, and loose on measures and outcomes, often focusing on outputs or program measures.
Built for Zero communities embrace that tight, loose, tight relationship by committing to functional zero and measuring progress by population-level reductions in homelessness. Bakersfield proved that flexibility and adjusting strategy in response to new data is paramount.
Quality improvement is a critical tool for creating a new reality where homelessness is rare and brief. The growing number of communities achieving functional zero proves it.
Redesigned systems can help us move toward the outcomes we want and that our communities and those experiencing homelessness deserve.